What's up, guys? We got Coach Tom in the house. Coach Tom is one of our Beat Fitness coaches over at the gym. Coach Tom started with us almost a year ago now. And ever adjusted before you start working here?
Few times.
Few times. One of the things Coach Tom has done in our facility, he's learned how to move a lot better. He's learned how to unify his body from his foot to his shoulder and from his other foot to his other shoulder. He's improved his walking gait, his running gait. You've altered your workouts a little bit?
Oh, 100%, yeah.
100%. What kind of workouts were you doing prior to starting here?
More powerlifter style workouts, so it would be kind of doing 2 reps a set, 3 reps a set, just going really heavy with improper form, always tucking my hips, stuff like that.
And has dealt in the past with what kind of pain? Any major injury?
Not a major injury. I've had like a few slight hamstring tears and then some hip tightness whenever my knees would always be discombobulated after squat day, all that kind of stuff.
And now you've learned how to rehab a little bit, right?
Oh, yeah.
Yeah, how to improve your squat form?
Mm-hmm, yep.
How to focus on your foot position and bilateral, meaning both legs, left leg and right leg symmetry, left arm and right arm symmetry. Tom, we get him adjusted maybe once a month, once every 6 weeks, but would you say you're pretty pain-free now?
Oh yeah, 100% compared to where I was, where my knees and my hips just used to be tight all the time.
Nice. How many days a week are we exercising?
5 to 6, just depending on the workload I got that week.
And what are you training specifically for anything, or I guess how did you get into training and what's your ultimate goal with training?
I got into training just through finding it as a new hobby whenever I was towards the end of high school there. I had never really been into it before, even with playing baseball, but I just started and I didn't stop ever since. And as I got along more, I kind of figured out that I wanted to maybe go a little bit deeper into it and possibly do men's physique here within the next couple of years.
Cool. Dude's a big kid. How tall are you?
Roughly 6'2".
6'2", and he holds his posture very well. A lot of the taller guys that come into the office, like 6'1", 6'2", 6'3", 6'4", some of our guys. Tall people, I think, for the most part, try to kind of get down on short people's levels, right? So one of the things, right, because you're always talking to people that are shorter than you.
Yeah.
So it becomes natural to almost like develop your kyphosis or sit more into your kyphosis. And so many tall guys come in here and they're just kind of like this. And we're like, yo, stand up tall, engage your back chain. We talk a lot about back chain in the workouts, right? Lats, triceps, a lot of back chain exercises where we get a lot of power. And you'll see some videos of Tom over in the gym. We've got him on social media a little bit, on our Instagram and on our Facebook a bit. But the dude's got a strong back chain. When the back chain is strong, we eliminate pain. Neck pain, low back pain, shoulder discomfort, all with back chain training. So you guys can check out some of our other videos on how to access your back chain. Pretty awesome. Tom also is currently a college student, right?
Yep.
Taking some prerequisites, which are what?
At the moment it's anatomy, but I've already taken bio. So, other just basic ones that you got to get out of the way before you get into your actual major courses, which for me would have been physical therapist assistant, but now I'm starting to look to get into chiropractic work.
Nice. What have you seen here at the office? Let's talk about that for a second. Like, when you started, you were like, I'm going to go to PT or PTA, and now Tom's thinking that he wants to go be a chiropractor. Started to take his anatomy classes, his bio classes, some of the prerequisites, the undergrad coursework, which is biology, chemistry, organic chemistry. Sometimes you might have to take microbiology. So there are, I forget the number of credits, but I think there's probably 80 or 100 credits of prerequisite work before you get into chiropractic school. But Tom here has been working with a lot of clients and patients at the office.
Yep.
What have you seen transformation-wise with some of the clients you've got to work with?
I would say the one that influenced me the most was a specific patient who couldn't reach his arm hardly above his head, and I saw even just within a couple months that he was able to nearly fully extend his arm up to the ceiling, and I mean that alone was pretty moving for me. But other cases outside that would just be seeing people who would be bending over naturally and then able to over time be able to have correct posture.
Correct posture, so important for lifelong health. If you're not conscious of your posture, gravity weighs us down, and stress weighs us down, and bad foods weigh us down, and really just all the negative choices that we make. You know, every day you have a choice to either do something with better posture, or maybe eat a better food, or you know, take the negative path, which is something that's fried and covered in sugar, or sit with bad posture, right? It's okay to eat some bad foods every now and then. You can't do it all the time though, because your body definitely slows down. It develops more aches, more pains, more chronic inflammation. The same is true for your posture. Standing tall and strong is so important to eliminate the unnecessary neck tension that we develop, low back tension, hip tension, all that stuff. And one of the clients Tom's talking about, I believe, was a guy that started with chiropractic care, and he got some progress with chiropractic care, but what we do in our office, we always recommend exercise. You got to exercise, you got to move, you got to get your heart rate up a little bit every week. If you can do it 3, 4, 5, 6 days a week, that's awesome. But if your schedule's busy, if you've got life and kids and home and all that stuff, just 5-10 minutes a day of stretching can instantly make you feel better. Guys, so Tom's in here. He doesn't really have any major complaints. So this is going to be more of a maintenance treatment. Just with our initial scan, our posture scan, very common, as you guys have seen in probably every other video, that people get tension up around the levator scap, the upper trapezius, the supraspinatus. This region right here is where so many people carry their stress. There's a number of muscles that attach from the occipital bone up here in the skull and the upper cervical vertebrae that pulls down here into the shoulder blades. And a lot of people say, well, man, do I have a lot of pressure up here? Tom's got a little bit of crunchy fibrous tissue in his right suprascapular region. So it's going to be where we're going to focus a little bit of myofascial release down into the right neck, the right shoulder, and then probably up into the neck a little bit just to help relieve some of the muscle tension, create some good circulation, some good blood flow into this region, and help to loosen up and elongate some of the muscle fibers. And then what we're going to do, guys, just start with a real light to moderate scan in a superior to inferior fashion. I'm going to throw some terms out here so we can make this a little bit of a study session for Coach Tom.
Got a midterm coming up, that's perfect.
Got a midterm. Who, by the way, guys, give a shout out to Coach Tom on YouTube, because he just aced his, first anatomy test or second?
I did miss a point.
1
so
point.
Not an ace, but
hey, that's all right. That's all right. Look up for me. Look down for me. Look up for me. Look down for me. Look up. Look down. What was the test on?
So chapters 7 and 8 for me, which would be the integumentary system, and then as well the chapters that contain the axial skeleton and the appendicular skeleton.
Axial and appendicular, beautiful terminology. Look up, look down, 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 hold it, look up, look down, look up, look down, look up, and down. Big pull down, chin to chest, good job. All right, relax right there. Feel a little bit of that?
Yep.
A little bit of soreness in there?
Yeah. Okay. Left one's been a little bit tight as well.
We'll hit that guy as well. All right, so guys, where does pain originate from? Pain can originate from all kinds of places: muscles, ligaments, tendons. But the big thing is nerve irritation. Nerve irritation that can cause muscle hypertonicity, tightness in the muscles. Look down for me. And Tom has got a beautiful, healthy neck. He's got minimal vertebrae sprain, strain, or injury. There's like just a little spot. You feel that guy like right there?
Right on the right?
Yeah, right on the right side. Just one little spot up in his C2 vertebrae where he's got a little bit of inflammation, nothing major. The worse that this inflammation gets up in the neck, the more we can have worsening conditions like headaches, migraines, radiating pain from the neck out to the front of the eye or the orbit, headache pain that can be felt kind of like over this right side of the ear. Pain can radiate down into the top of the shoulder, over to the deltoid, and the lower that the vertebrae get irritated and compressed. The lower, when I say like down to C3, C4, C5, C6, and C7, you can have more pain, numbness, tingling, sensation down into the wrist or the fingers. Look down for me. Did you study anything about dermatomal patterns yet?
Not yet, no.
Not yet, awesome. So dermatomal patterns are how your nerves and your brain, and we're going to just do a little forecasting of what you're going to learn. You have two cortexes. You have a motor cortex and a sensory cortex up in your brain, and they're like two portions on the right lobe and the left lobe, or the right hemisphere and the left hemisphere of the brain. And the way that the brain is organized is, or I should say your nerves, C1 is going to control sensation and some of the motor output high up here in the head. C2, C3 down into the shoulders, C4 and 5 down into the deltoids a little bit, and then C6, C7, C8 nerve, and T1 down into the hands, wrists, fingers, and up into the back of the arm. And when we get into the thoracic spine, T1, T2, T3, T4 radiates right around, just like this picture back here on the wall where we've got your thoracic nerves, your cervical nerves. The cervical nerves create the brachial plexus. The brachial plexus is comprised of 3 branches that run down into the arm. So you've got your 3 nerves, your median nerve, your radial nerve, and your musculocutaneous nerve that go down into the arm. And your ulnar nerve, as well. So the median, the radial, and the ulnar nerve, which kind of come down from the elbow down into the fingers. Carpal tunnel is typically these 3 fingers. Ulnar neuropathy, the lateral 2. So nerves can get entrapped in the elbow, the wrist, high up in the shoulder, or even up into the neck. And so where you have your pain at kind of pinpoints where we need to work at. Look down for me. So for all you future chiropractors out there, or physical therapists, undergraduate is very important. You get a lot of your undergraduate coursework done, like your bios, your chems, all that stuff we talked about. And then you move into your chiro degree, your Doctor of Chiropractic degree, which is a 3.5 year to 4 year program if you power through. The course load or the coursework is pretty heavy. I remember when I was in school, Monday through Thursday, we were in class from like 8 to 6. We'd go to the gym after class, and then we'd go to the the cafeteria and eat, or we'd go straight to the lab after gym and then eat after. But dude, in chiro school, you get to go to anatomy lab, you get to dissect cadavers, which is pretty amazing to see what the human body actually looks like under the skin. Look down for me. Look up. Look down. Look up. Look down. Look up. Look down. Good. Relax right there. Look up. Look down. 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 Straight down, chin to chest. Look up. Look down. Look up. Look down. Look up. Look down. Look up. Look down. Look up. And look down. And look up. And look down. Beautiful, dude. Okay, relax right there. Now we're going to hit left side neck. Look down for me. Look up. Look down. Look up. Look down. Look up. Look down. Look up. And down. Look up. Look down. Look up. Look down. You guys will see sometimes we treat more on the posterior side of the neck, or the back side, the lateral side, and sometimes we might even get over here into like the SCM and some of the anterior cervical musculature, like the platysma muscle, the SCM, some of the other cervical flexors. It's got a little bit of tension right through here, we'll feel. Very common for lymph nodes under the jaw, the mandibular lymph nodes, the posterior cervical chain of lymph nodes, things get congested up here in the neck. If you're sick, if you're fatigued, if you are just feeling congestion or pressure up in your head, your throat, your ear, even up into your eyes, some people feel eye pressure, you want to release the upper cervical musculature, the lateral cervical musculature, as well as some of the stuff in the front, like the SCM muscle, which gets these nasty trigger points high up right under the jaw right here. Let's tilt left and then tilt right. And then tilt left and then tilt right. And then tilt left and tilt right. And then tilt left and tilt right. Chin down. Head up, head down. Head up, head down. Head up, head down. Wonderful. All right, big man. Let's go face down on the table for me. Down here, Coach Tom did some rock pulls yesterday, right?
Yep.
And again, no pain, so this is just a maintenance treatment to his lateral hip musculature, the glute medius, the glute minimus, a little bit of the IT band out here. Never hurts to get a little vibe therapy down around the sacrum, down around the pelvis, the low back. Helps to stimulate blood flow. It helps to desensitize some of the muscle tenderness, tension, or hypertonicity. Sometimes these things are ticklish, sometimes they're tender. But ultimately, the sensitivity of the lateral hip and the superior crest up here around the ilium decreases with a little bit of hypervolt treatment. Nice. All right. All right, big man. Here we go. Let's get some good adjustments today.
Yes, sir.
Yes, sir. Okay. Deep inhale. Exhale out. Whole way down for me. Whole way down for me. Whole way down. Good. Nice. Breath in. Exhale out. Whole way down. Good. Nice. Inhale through your nose. Exhale through your nose. Last one right here. Whole way down. Nice, man. All right. Face over to the window, right side up. So, thoracic adjustments. Thoracic is the mid-back, what we just worked on. Scooch towards me here. Thoracic adjustments. Most of the time we do them in extension. Sometimes we pair them with a little rotation, depending on what degree or what position that vertebrae we feel is restricted in. Roll. Breath in. Exhale out. Whole way out. Good. Nice. Good. Other side for me. Low back, we always adjust into a little rotation and extension. Here and here. To get us into our back chain. Very few people, from what I find, are in a hyperlordotic. Breath in. Exhale out. Nice. Flattening your back. A hyperlordotic, which means too much back extension. Although it does happen if we get this like sway back posture, it's called. Posturally, we want to stand with our feet narrow. We want to be entered into our back chain, which means shoulders in front of hips, chest up. That's where we get really good spine health. The head sits over the shoulders, but we kind of get with our go-to coaching into this forward gear position where we can develop power and energy out of our foot, up into our leg, back into our glute, and ultimately up into our lats so that we can explode through. Relax for me right here. Nice. Good. Relax this shoulder down. Oh, that feels good, man. That's good today. Got the elbow extension going on,
yes,
huh?
Sir.
Relax this in. And good. We will do a little thumb work. Relax here. There we go. Nice. Okay. Hands on thighs. Right here. Nice. Grand finale. Right here. Relax here. Nice. Good. Nice. Beautiful. Sit up tall. Spin to the right. All right. Big Tommy coming along. All right. Scooch forward 1 inch for me. Hands back and down. fingers in. All right, guys, one of my favorite exercises we're going to show Coach Tom how to do today, and he's going to own it like a champ. Back chain activation. Back chain activation. I like to get palms in, palms down, fingers in, elbows power up, shoulder blades power back. Anybody that works at a desk all day, we say open up your chest, access your back chain, get your tris firing, get your lats firing, stretch your pecs, stretch your biceps, feel the stretch down into the wrists and the forearms. Feel how your left shoulder feels, feel how your right shoulder feels. Right side's tight side, right?
Mm-hmm.
Can you tell the difference?
Yeah.
All right, so if I say coil left shoulder blade back. If I say coil right, he's got a little bit tougher time. Head up, chest up high. He's got a little bit tougher time accessing his back side, right side, back chain right here. Feel how that side feels, left side. So Tommy, in between studying and book reading and diagram drawing, all the good stuff that we gotta do when we study, we gotta take a little stretch break every 30 minutes for like 2 or 3 minutes, accessing our back chain so we can keep our circulation flowing, our lymphatic system flowing, our muscles pumped up and healthy, back to center, shoulder blades open, and our lung or our thorax, as well as our abdomen nice and opened up so we don't end up all tired and fatigued at the end of the day. Double shoulders open, beautiful. All right, my man. Thank you guys. Subscribe to the channel if you're not. Stay tuned for follow-up chiro videos, follow-up training videos. Catch Coach Tom here at B Fitness in Wexford if you guys live in the Pittsburgh region. We'll see you later.